But I want to just remind you that the reason glucagon is released is that, as we discussed yesterday, the brain senses a drop in blood glucose. So it sends signals to the pancreas to increase glucagon release. It sends other signals to increase epinephrine synthesis, cortisol, and so on. So the key there was a drop in serum glucose. So that's the normal body response, is sense or notice a drop in serum glucose, you respond by producing glucagon, epinephrine, and cortisol. If the body doesn't respond appropriately, you're going to have a condition called hypoglycemia, meaning a decrease in normal serum glucose. Probably anything below, say, 70 milligrams. The normal concentration is somewhere between 80 to 100 milligram per deciliter. So if glucose drops significantly, say to about half, you're going to its normal concentration, 40 to 50 milligrams per deciliter, you're going to, the body will start, that's again has to do with that brain sensing the drop. And usually the body can respond in one of two ways. So the first symptoms are called adrenergic symptoms. So you get anxiety, tremor, palpitations. That's the brain telling you there's not enough glucose in the bloodstream. And usually the release of glucagon and so on ensues. But if it doesn't, it becomes even worse. So you're going to get confusion, aberrant behavior, could even lead to coma. So there's really two ways that two types of symptoms can result. For the first one is the more common one, that the body is trying to respond by, the brain is trying to respond by increasing, say, glucagon and epinephrine. In the second case, these symptoms or the drop in glucose happens so gradually that the brain doesn't even register. So they can be much more serious, and they can result in can result in seizures, coma, and that's because usually of a slow drop in glucose that kind of the brain does not detect. But anyway, as a general rule, hypoglycemia can be easily treated with glucose, either oral or IV glucose. Within a few minutes, everything gets back to normal. There are different reasons or conditions that produce this hypoglycemia. The first normal kind of condition is due to excessive insulin production or insulin administration, if you want. Let's say you have a diabetic patient with type 1 diabetes and they're on insulin injections on say 2-3 times a day. If they take their insulin injection and forget to eat, they're going to turn or go turn hypoglycemic. Okay, so usually for diabetic patients, you tell them, okay, you need to time your meals with your injection. You have to eat within a certain time, within 10-15 minutes of the time you take the insulin shot. Okay, so if they forget, then they can be. There's another one which occurs in normal individuals. It's called postprandial. That means you might eat a little bit and there's a bolus production of insulin, and it causes a lot of uptake of glucose from the bloodstream, and it could lead to hypoglycemia. Okay? So you have excess insulin secretion relative to the amount of food ingested. Obviously, you have hypoglycemia due to fasting. You haven't eaten in a while, blood glucose drops. The normal response is to manage it by glucagon or epinephrine release. However, fasting also includes pancreatic disease, meaning if the pancreas has some, say, a tumor that overproduces insulin, many pancreatic tumors do that, that can result in hypoglycemia. If you're not sure why you're getting hypoglycemia with excess insulin, the reason is that, remember what insulin does to glucose uptake. It increases glucose uptake in muscle and adipose tissue. So if you have too much insulin, not enough glucose in the bloodstream, a lot of that glucose will be taken up, and that's the cause for hypoglycemia. And finally, another cause for hypoglycemia is alcohol. Okay? Excessive alcohol use can result in hypoglycemia. This is a very important concept, and it's a unique concept in terms of the effects of alcohol on metabolism. So alcohol is metabolized by two enzymes. Alcohol is ethanol, okay? The common alcohol. The ingestible alcohol is ethanol. When it is metabolized by two different successive enzymes, alcohol dehydrogenase and acetaldehyde dehydrogenase, two of these enzymes successively produce NADH. So there is a rise in cellular NADH. I want you to now think about where this NADH can be used. If you have so much of it, it can be used to convert pyruvate to lactate. Frequently, alcoholics will have lactic acidosis. That's part of the reason, the main reason, actually. High NADH, pyruvate to lactate. High NADH converts oxaloacetate to malate. And high NADH converts DHAP to glycerophosphate. Why are these conversions important? They're important because pyruvate, oxaloacetate, and DHAP are all intermediates in gluconeogenesis. So you are depriving the precursors of gluconeogenesis, removing the precursors of gluconeogenesis due to the excess NADH. If you don't have gluconeogenesis, you cannot resupply the blood with glucose. Okay? So that's a very important concept. A lot of people don't always understand it. So if you understand it now, it'll help you later. If you like this video, please subscribe. Thank you.